Hello everyone, I am Naveen from Erode Secondary Engineering College. I am pursuing second year in biomedical. Today I am taking the topic about strength duration curve. What is strength duration curve? A graphical representation to the relation between strength and a duration. The strength of electrical stimulus and the duration of stimulus pulse. It is used to evaluate nerve and muscle excitability. Important in physiotherapy and electrodiagnosis. Then historical background, development of concepts. Introducing in electrodiagnostic studies, it is used to access nerve injuries and muscle responses, helped improve electrical stimulation technique and widely applied in rehabilitation medicine. And then basic principle, short duration pulse require higher intensity and long duration pulses requires lower intensity. The curve demonstrates inverse relation between strength and duration. An important concept is excitable tissues respond differently dependent on pulse parameters. And then components of the curve, main components, x-axis pulse duration and y-axis stimulus strength current intensity. Threshold point, minimum stimulus needed for response, curve shape and tissues conditions. And then Rio base, in Rio base, minimum current intensity required to stimulate a muscle or nerve using a long pulse duration. And then measured with long duration pulse, it indicates tissues excitability and lower rebase equal to higher excitability. And then definition of Cronase, minimum pulse duration required to excite tissues using twice the Rio base current, and it important is to indicate nerve and muscle health, then helps differentiate normal and abnormal tissues, useful in diagnosis of nerve injuries. And then normal strength duration curve, smooth curve shape, sharp rise at shorter pulse duration, represent healthy innervated muscles, clinical interpretation, normal nerve supply, and then good muscle responsiveness. Then denervated muscle curve shifts upward and to the right, requires longer pulse duration, higher intensity needed for stimulation, clinical significance, indicates nerve damage or denervations. Then partially denervated muscles, features of this is combination of normal and denervated responses, irregular curve shape, intermediate response pattern, interpretation, partial nerve injury, and some intact motor units remains. And then procedure of recording the curve, prepare patients and equipments, place electrodes correctly to the patients, and apply electrical pulse of varying durations, record minimum intensity causing contraction, plot the values on graph paper and software. Clinical applications, used in physiotherapy, diagnosis of peripheral nerve injuries, assessment of muscle innervations, treatment planning, monitoring recovery after nerve injury, selection of stimulation parameters. And then advantages and limitations, the advantages to non-invasive method, useful diagnosis tool and helps monitor progress. For the limitations, require patient cooperation, result may vary with technique, time consumption, procedure. Modern developments are technology advancement, computerized electrodiagnostic system, more accurate measurements, digital recording and analysis, integration with rehabilitation technologies, future scope, improved diagnostic accuracy, and then AI assisted interpretation. Conclusion, summary, strength duration curve is essential in electrodiagnosis, helps evaluate nerve and muscle function. Rio base and Cronase are the key parameters, valuable in rehabilitation and physiotherapy practice.